Welcome to the 483rd episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Welcome and thanks for listening. I'm on my way to being an endurance athlete again. It's been a long road, so I hope these injury updates kind of go away, and I think they are from now on. I'm just going to tell you what my mileage and everything's going, but I went ahead and had a CAT scan of my lower extremity, thinking that there's potentially something out of place or something impinged. Good news. I'm a plant-based endurance athlete with normal bones, good bone density, no joint issues, no knee arthritis, no arthritis anywhere at 61 years of age. Little tendonitis in the posterior tibia, but that's getting better. As far as where this nerve issue is coming from, don't know, don't care. It is most likely just a little bit of overuse or some post-100-mile race, little fiber entrapment that's just got to work its way out. So all good. I was asked, so how do you feel after the CT scan? And relieved, because one of the potential diagnosis would be a healing stress fracture, which would, one, mean I got a stretch fracture, and two, means that I would have to probably curtail what I was doing even more. So that's not the case. There's nothing that seems to be pointed in the wrong direction, so that's good. So no surgeries or anything like that. The question is why. Some people get, I've had people over the years come to my office after they've had a CT scan and it didn't show anything, and they would say, they were disappointed. And it's like, no. You should be disappointed in that there's nothing bad wrong. But they would be disappointed because they still didn't know what was wrong. And sometimes we just don't know. But if you can exclude the bad things, then the little things tend to take care of themselves. So I spoke with a friend of mine that was a trainer for the Buffalo Bills. Shout out to Bud Carpenter. Anybody that listens, that follows the Buffalo Bills, fabulous trainer for many years, and friend of the family. And he suggested that we just work through it and continue strength training, continue to start running again, and everything will be okay. So that's what I'm doing. So I am committed to 3 days. This is week 2 of 3 days a week strength training, and I'm starting to up my mileage. So the plan is on days that I strength train, my mileage will be lower, so that Tuesday, Thursday, Saturday, Sundays will be the days where I bump the mileage up gradually. And then when that's up, then we'll start to bring Monday, Wednesday, and Friday up as well. The other thing is that it is still very much in my desire to do mountain hilly races, so I can't just pretend hills don't exist. So on the Tuesday, Thursday, I'm going to put a treadmill hill there and work my way up there. And so far, so good. The original plan was to do 30 seconds run, 30 seconds walk, mainly with Sophie, who's a better lead runner. But, 3-0, he's like, 3-0, let's give it a chance. So he actually is somewhat better runner than he is walker as far as being behaved. So other than walking with him when he has to take a pit stop, or something gets in our road, I've been actually running with him. So I kind of went from 30 seconds on, 30 seconds off to, first day I did 30 seconds on and then 4 minutes off. Pretty much now I'm 4 minutes on, 30 seconds off. So speed's not there yet, obviously, and not quite pain-free, but not too bad and not worse afterwards. So I'm not taping. I'm doing my exercises, and that's my story, and I'm sticking to it. We have the Rattler 50K in November. The question is whether or not we want to put another race on before September, October. Kind of have the itch to do that. Still dealing with the disappointment of not racing in July or August, so it's kind of been the longest time period without ever doing a race of some sort. So I kind of want that carrot of having a race, something to put on the calendar. We'll see. Going to give it a week or two. There's plenty of races to choose from, September, October window. in the East Coast, most likely, that we could hop into if we decide that it's worth a gamble. But I kind of think I'd like to do it, but we'll see. I don't want to do too fast. I don't want to get re-injured. I want to see how the strength training goes. So far, my legs feel pretty good, despite not having run for several weeks. But granted, I've always kept the walking up. So since January, part of the time I've run, got up to 13 milers, but I've never really done any days without walking 2-3 miles, mainly because of the dogs needing to go get their exercise, and, some sense of clearing my head. And walking really doesn't do much harm unless there would be a stress fracture, I guess. So, I've been doing the walking any place from 2 to 5 miles. So I'm hoping I'll come back pretty quick, but I'll let you know. Just when, you start feeling sorry for yourself a little bit that, I have an injury and I haven't been running. Of course, there were some doubts a few weeks ago. Would I ever get myself back to doing the mountain runs and challenging races? Am I a flatlander to always be whine, blah, 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 blah. A new member came to the practice who told me his story and added another perspective on what you can do and what you can't do. At age 2, he was hospitalized with a fractured leg. I believe he's in his early 70s now. So at 2 years of age, he went to the hospital with a broken leg, and while he was in the hospital, he contracted polio. It stopped at his leg, so he didn't need to be on an iron lung, but he was in the hospital with other kids with polio, so obviously it was quite the scare for the family. Nobody else in the family got polio. And it was suggested that maybe I think he may have wore braces for a little bit, but that maybe go to a special school or special programs, and his dad said no, he's going to just be treated like his siblings. Fast forward, he went on to play baseball in high school, so good that he went on to play baseball in college. I asked him what position he played. He was a pitcher. So he a right-handed pitcher with a right lower extremity that's half the size of the left lower extremity, muscularly wise or muscle-wise. He went on to be a contractor. He builds houses, does physical labor every day of his life, and continues to do it, and is doing pretty well. He's having a few symptoms now that comes with perhaps some need, and the reason why I came to the office is for lifestyle modification so that he can maintain his strength and keep himself upright as he gets older and enjoy his later years. But again, it never ceases to amaze me when, nothing stops people that don't want to be stopped. He did make mention of the fact that had he not broke his leg, maybe he would have been able to get the polio vaccine, and it might never have happened, and maybe that's why his siblings didn't get polio. And we didn't have much of a chance to talk about it, but I was curious that he got polio in the hospital. Polio has been associated with excessive, at that time when polio was, I would say in the 50s, late 40s, 50s, there was a lot of DDT spraying, a lot of pesticide spraying. It was just when that was starting to post-World War II. Water contamination, and polio spread through the GI tract. So it typically went through families because of, contamination. If there wasn't a lot of hand washing, bathroom type of things, polio could be spread from family to family, but none of his family members ever got it, at the time he was in the hospital. But I couldn't help but wonder, how he got polio in the hospital. It's supposed to be a sterile environment. He didn't live in an area that was endemic to spraying. Water was clean. They didn't live in any rural area where there was wells, because that was associated, at the time with contracting the polio virus. But when I started thinking about it after I saw him, the early polio virus was actually a live virus, and that was one of the controversies. It was actually because polio, the fear around people not being able to breathe and iron lungs and everything, it was certainly released. As soon as it was available, tested in wide areas on people, or given to people in wide areas, and the live vaccine has been associated with actually shedding itself and transmitting the polio virus. So I couldn't help but wonder if the polio vaccine itself in the hospital, or somebody with it, may not have been part of the etiology. Nobody ever knows. But certainly, can't go back, but he certainly has done well despite having polio. So good on him. He's an inspiration, great attitude kind of guy. It's taken him that attitude has taken him wonderful places in his life, just like other people that I've had on this podcast. Many people have attributed the polio vaccines as being one of those life-saving vaccinations that turned the tide, certainly in the United States, with a devastating disease. And that may very well be so, but there are also other confounding factors and changes in the way it was diagnosed. And there was also a risk and benefit associated. So certainly not everybody did well with the vaccine. Certainly there were some side effects down the road with the vaccine, but a lot of people were saved. And we look at the risk versus benefit of procedures that we do. And as I have become more holistic in my practice, so to speak, and looked and seen the benefits of a plant-based lifestyle, diet, exercise, stress reduction, and then looked at some of the procedures that I have done in the past, the procedures that are currently done, procedures that we thought, and testing that we thought were saving lives that actually weren't, maybe doing more harm. Most of medicine has a risk versus benefit type of ratio, and it's very difficult for people when given a diagnosis to figure out, or given a choice, the risk versus benefit. We can look to studies and see percentages, but when you apply that percentage to you, obviously it's impossible. And especially when we talk about procedures in extremely healthy people that have the potential to harm them when they were healthy to start with. It is one thing if someone has sudden death and CPR is initiated and there are ribs that are broken, but the patient saved. Obviously the complication of ribs being broken, but the patient's lives being saved were well worth it. The patient was going to die without the CPR, versus someone that, again, was maybe getting a screening procedure and had an adverse outcome, and they didn't have the disease in the first place. So risk versus benefit, certainly very wide across the board. But the more I practice, the more I see the risk, and the benefits are becoming more gray in a lot of areas. And that's, I had the conversation with somebody today. That's why, people in this community are so passionate about lifestyle modification, because the risks are so few and the benefits are many. And it's a thing that wouldn't hurt anybody. So if somebody in the family became plant-based, it certainly is not going to have negative consequences on the rest of the family. There's no harm to anyone with the plant-based diet, with increasing exercise. And so it becomes such an obvious choice to incorporate in therapies and in lieu of some procedures as an alternative. That's hard to watch and see people, not see the beauty of plant-based nutrition. It's also hard to see, the practice of medicine in this country that is somewhat defensive medicine, and that sometimes things are called on an X-ray, say a mammogram. so that maybe overcalled, so not to miss something, because the fear of missing something and being sued is so great. So we err on the side of over testing. So even in this country, we spend way more money on procedures and testing, and we have a much greater health care expenditure, but no more benefit. And we're actually down pretty far on the list as far as health span, despite all the excessive amounts of testing. So it's not come out of the wash with all the things we do, extra scanning from head to toe and excessive mammograms and colonoscopies in people that it may not be indicated in, doesn't really pan out in the end. But it's done out of fear. If you miss a colon cancer, you're pretty much dead in the water as far as if you get sued, if you miss a breast cancer on a mammogram. And it's kind of funny because there are some risks with mammograms, the risk of radiation. Some might say there's some other risks to the harm, the potential of having a biopsy and it being a false positive, getting infected. So it's not without risk. But the doctor's kind of held responsible on both ends of things. So you can't miss something. And if you do overtest and something happens, you could get into trouble. So again, the practice of medicine is more fear-based in a lot of instances than in logic-based. The reality of it is a early stage breast cancer could be diagnosed and the patient have an adverse outcome from treatment and die early, or even die of a different disease, and nobody thinks about that, or that's not associated with a bad outcome, versus the risk of missing the cancer in the first place. So it makes practicing medicine in the United States very difficult, and I think again we tend to over practice instead of look back and individualize things. So when we do group therapies or group recommended consensus statements, a lot of the times it's for the masses, so we don't miss anything in anybody, but are willing to accept hurting other people. I was told in my cardiology fellowship that I needed to get used to hurting the occasional person, because if we were going to stick needles and catheters in people, somebody was bound to get hurt despite our best effort, and that was unacceptable to me. I never have and never will be okay with the hurting someone as a statistic, and being okay with that. And I think that is perhaps sometimes necessary when people do things that they have a high percentage of people that have pain and suffering despite their therapies, but it's just not acceptable to me. I stumbled upon a YouTube video this week. Not even sure how I stumbled upon it, but the video was about a neurosurgeon that was looked like hiking in the Colorado mountains. And I guess what caught my eye was the picture of the mountains. It looked like the Rocky Mountains of Colorado. And I got excited. He was hiking with his little dog. And it turns out that the name of the YouTube is Gooby and Dooby, and Dr. Gooby is a neurosurgeon no longer practicing. And a similar thing happened to him in that in neurosurgery training is one of the most difficult difficult specialty trainings of all residencies. A neurosurgeon goes through 4 years of medical school, 5 years of general surgery, and 3 or 4 years of neurosurgery residency. So they're well advanced in age by the time they finish. And it typically is a brutal call because neurosurgery programs are typically at trauma centers, so accidents with head traumas, bleeds, brain tumors, and obviously people are very, very sick that have any of those. So it tends to be a very, very grueling residency. I would say one of the most grueling residencies that there is. My good friend from medical school is a female neurosurgeon, no longer practicing. And at the time, there was the joke was there were 6% of all cardiologists were women, but 0.06 of all practicing neurosurgeons were women. And I would doubt that it's a whole lot higher now, just because family life and neurosurgery practice would be so difficult. Not because, obviously, they're not capable, but it's just a very demanding. You are certainly married to the practice of neurosurgery. But anyway, Dr. Gooby thought his path was going to be implanting devices that allowed people with paralysis to move their arms and legs by thinking about them and doing research. So he was one of the top medical centers, and that kind of, became something that was certainly out of the reach in the near future for him. So he decided to be a spine surgeon and do surgeries on discs and backs and things, and the outcome was not good. Back surgeries are often associated with chronic back pain. Rarely do people get one back surgery and not need another back surgery at some time in their life, because you kind of immobilize one part and causes another part to shift and problems. There's all kinds of scar tissue. And the reason why people get back pain in the first place is more often than not secondary to lifestyle factors. There's this one spinal artery, small arteries that go and feed the vertebral body. So when there is wear and tear and maybe an injury, it's very difficult to heal, especially if vascular disease certainly plays a huge role. So oftentimes people that have back problems also have vascular problems, so it's very hard to heal any kind of an injury. Overweight, scar tissue, on and on and on. So again, the success rate is very low. But what Dr. Gooby came to find out is that when he talked to his patients about plant-based nutrition, exercise, stress reduction, meditation, walking, often his patients would get better while they were waiting on their surgery to be scheduled. And it's true, most disc bulges, if you can stand the pain 6-8 weeks, will actually heal on themselves. And again, with certain exercises that we do in our practice and incorporate. I had Dr. Stu McGill on the podcast at one point, but most back surgeries need not happen if people do an exercise intervention, and certainly lifestyle interventions such as good nutrition, increase the blood flow to the area, decrease stress, increase movement, walking, and so forth. It's certainly a painful. If you've had a disc or sciatica issue, it's not without significant pain, and it is somewhat hard to endure. But often, again, most of the time it'll get better. But because the pain is severe, most people want a quick fix, and so they'll do elective surgery. But he was starting to see that he was having more success by talking to people about plant-based diet and nutrition and lifestyle modifications such as exercise and so forth. That he became very conflicted ethically to take people to surgery, knowing that they probably weren't going to get better, but if they would do this, lifestyle modification, that they would. And the other dilemma was it's hard to make a living as a neurosurgeon telling people to eat plant-based and not doing surgery. The way surgeons make a living is doing surgery. And surgery, especially neurosurgery, is one of the most lucrative procedures for a hospital. So hospitals desperately want neurosurgeons to be there and to practice and to do surgeries. So when a neurosurgeon's not doing surgery, the hospital loses and the doctor loses, and the patient has the potential to win, but again, it's somewhat of a struggle to get that across. And so he really, after practicing 9 years, decided that he couldn't face practicing anymore, and gave his neurosurgery practice up. And now he, has somewhat of a preventative goal to, spread the word as far as lifestyle modification to improve overall lifestyle, including back pain and spinal diseases. So I thought that was very interesting. Kind of a shame in that, again, we spend all these years learning to do procedures that carry significant amount of risk to them and maybe little benefit, hoping to save a few people, when simple interventions such as changing your diet and exercising and stress reduction can have such a profound impact on life without ever causing harm. So, as I was talking earlier, I haven't been able to run, but I've been able to walk, and sometimes I walk with Trio, that's my young male German Shepherd, and we do more training than not. So learning to walk at my side in a heel position, not to pull, not to chase rabbits, not to lunge at other dogs. And so it requires stop, start, stop, start. Maybe, I think one day I probably went almost 1/10 of a mile in the wrong direction, just circling. We'll circle back around and go into a heel position. And while I was injured, one of the ways of dealing with it was, okay, we'll just focus on training 3-0 to walk on a leash so that my 4-year-old grandchild could walk him. He would be so good by the time we got through this. So far, 3-0 can only be walked by a 4-year-old if he's already walked probably 5 miles. But he has these moments, and he's doing much better. But our pace will vary depending on how many times we would have to stop, from, say, 18 to 22 minutes a mile if we're doing training, stop, start, all those things, which is very slow. When I'm starting to feel better, I kind of gauge myself when we're walking, when we're walking good and he's at a heel and he's by my side and we're doing good, we can get into the probably just sub 15, maybe 14:30, 15-minute mile, and kind of hold a 16:40 pace. And you can, the reason why 16 minutes and 40 seconds per mile, and the reason why I know it is I watch it a lot, because it's how I make the time go by when we're walking at 6 o'clock in the morning. And so I know the pace that we're walking, in accordance to how he's behaving and where he is. And certainly if I'm with Sophie and she walks at a very good heel right beside me, then we can do the, low 14s, high 15 minute mile if everything's okay, my ankle's not too wonky, and so forth. And it has come up in the office, well, how fast should I be walking? What's a good pace? And someone in the practice actually Googled it, and they came up with, at 65, I think a 7 or 8 minute mile. And it's like, and so she was so disappointed in herself because she takes, about 15, 16 minutes to walk a mile, not 7 or 8 minutes a mile. And she thought she's in such bad shape that, no wonder, she's having some issues and she's really got to do something to turn things around. And it's like, no. When people Google a mile time, that's like, and that was an elite 65-year-old running a 7 or 8 minute mile as a good pace, not an elite, an athletic runner type of person running a 7 or 8 minute mile. It takes a lot of effort to run 1 mile at that speed. It's certainly not a walking pace. And, people over the years have come into my office and they tell me what they walk and how long. And I just giggle because, again, I know these paces. I know what I run. I know when I walk. I know when I have 3-0. I know when I have Sophie. So I have a wide range of paces and what that feels like. When someone starts a walking program and tells me that they're walking a 10-minute mile and they're, 5'4", it's impossible, because it's almost impossible for anybody to walk a 10-minute mile. I have a member of the practice can do 14s, 14 and a half, but he's got really long legs and he practices speed walking. So it's not that easy. But the question comes in, what should we walk and what should our goals be? And for most people, it's duration, because the duration of the walk that builds cardiovascular reserve and mitochondria and improves cardiac function. So I like to see people walk a duration more than speed at first. And then as they do that duration, say an hour being the magic time, the better they get at walking that hour, the faster that it will get. And so then you improve there as well. And we have people walk with heart rate so that they can maintain themselves in that zone 2 range. So 220 minus your age, and about 70% of that, and try to walk that for an hour is kind of the gauge. But the other thing is, can you breathe through your nose when you're walking? People that are huffing and puffing and you can't talk when you're walking, it's too fast. So the other thing, besides breathing through your nose, is can you carry a conversation? You should have a little bit of not quite what you're sitting on the couch talking, but you still want to be able to carry a conversation. There's a thing called the Pledge of Allegiance test. So if you're walking, you can't say the Pledge of Allegiance, you're walking way too fast, or even running too fast for the most of the time. But there was a recent study done that looked at heart rate response to exercise and was it predictive of cardiovascular events. So they looked at not only the peak heart rate achieved, but how quickly they achieved that heart rate. So to step back just a moment, when I'm doing a stress test, and I'm watching, we have people hooked up to a heart rate monitor, so we're watching their electrocardiogram, and we're watching them walk. And a typical cardiac stress test uses what is called a Bruce protocol. And a Bruce protocol is very specific in that it measures the metabolic equivalence. I've talked about it in the podcast before. If you can do 10 metabolic equivalents, it's the equivalent of shoveling snow or shoveling, driveway or whatever. If you can only do 3 METs of activity, which is like less than 3 minutes on a treadmill, on the Bruce protocol, then that's the equivalent of almost being able to make your bed. So it goes, there's a variation in between, but this treadmill starts very slow at a little bit of a grade and then goes up in grade and in speed every 3 minutes. So this study looked at people exercising on a Bruce protocol and specifically what their heart rate was at stage 2. So again, 3 minutes, so it would be from minute 3 to minute 6. And on a stage 2 Bruce protocol, that is 2.5 miles per hour or at a 12-minute pace. And to go up to what was before, that's a 24-minute per mile pace. So not very fast, but at a 12% grade, so it's a pretty steep hill at stage 2. So what they noted was that the higher your heart rate approached a high heart rate, or 85% of the predicted max heart rate, the higher the heart rate was in stage 2, or the higher the percentage of your maximum heart rate, the worse the prognosis was. And you can predict exercise duration by every 10 beats a minute that it's elevated. You kind of shorten your ability to walk about 45 seconds. So when they looked at people in stage 2 Bruce protocol, and they were less than the 10th percentile, they had a greater exercise capacity for their age and sex. So meaning that the lower your heart rate was, so the slower it goes up, the better shape that you're in. So you can do this at home when you go on your walk to see how quickly your heart rate goes up when you start to walk. Now, you have to be aware, sometimes people wear heart rate. I don't wear a chest strap anymore. I just use the watch, and the watch has a pulse oximeter. It's under that measures your heart rate through the capillary underneath your wrist bone. And if it's not tight, or if it's cold, or it's not in the right spot, you can have some variations early on. So you have to take that into account to see whether or not, it's accurate or not. But on average, when you're walking every morning, if you look down, 5 minutes into your walk, you can see when your heart rate starts to go up. And if your physician has prescribed a heart rate for you to try to walk at, if you get to that heart rate very quickly, then you can kind of watch that over time and see that start to go down. So that's another sign of progress. Not only can you walk, up to an hour, but the question is, can you walk at an hour at, a heart rate that's in that 70% range without having to slow your pace down? Another thing that happens as we exercise, the longer you walk, the more your heart rate tends to go up. So a Bruce protocol, every 3 minutes, the speed of the treadmill and the elevation of the treadmill go up. So we do that so that the treadmill test doesn't take all day long. There are 7 stages to the Bruce protocol, and it gets up to 7 miles an hour at a very steep grade, and so most people never complete that. 10 minutes on a Bruce protocol is great. More than 14 is an endurance runner that is running at speed. So I would say a good marathon runner can go over 14, 15 minutes. But most people, we look to see if they can get 10 minutes. And I always tell my patients, you don't want to get off that treadmill until you get 10 minutes if you possibly can, because if you can go 10 minutes on a Bruce protocol, it's an excellent prognosis, regardless of how things go. But if you're out walking and your heart rate starts to go up quickly, again, look at it over time. If you're making progress, you shouldn't see that. The other thing that was associated with it is people that's heart rate doesn't go up is more of a bad prognosis as well. So if there is a problem with the conduction system, people's heart rate may be low and not go up. So they can't change gears when they exert themselves. And that is somewhat indicative of potentially needing a pacemaker at some point. But most people, it's on the other end of the scale. So heart rate goes up very quickly. When your heart rate goes up, you're delivering less oxygen to your tissues. You can no longer burn fat. You're burning your carbohydrate stores off. You start to generate lactic acid, and that's what causes people to stop. So I can watch people's heart rate on a treadmill test, and I know when they're going to stop before they know when they're going to stop, just based on when their heart rate starts to accelerate and start to go up. And that is an indication that when that heart rate starts to go up, that they are starting to approach what we would call their lactic acid threshold, their anaerobic threshold, where they start to metabolize only carbohydrates at greater than 85% of their predicted maximum heart rate. If you're walking in Florida heat, your heart rate will go up quicker when it's hot and humid than when it's 45 and not humid. So you have to take that into account. So you have a summertime drift in your heart rate, and you have a wintertime heart rate. You can also tell when you're getting dehydrated if you're out for a 2 or 3 hour event. If your heart rate starts to go up and kind of stays up and goes down less quickly, you know that you're losing the battle on hydration a little bit. So it's another thing that you can use heart rate for. I would be remiss on the Plant-Based Wellness Podcast if I didn't talk about mangoes. Mangoes are ripe. The mangoes are off the trees. We have several varieties that were ripening off the tree or finishing ripening off the tree, just so we win the battle with the squirrels and rabbits and other varmints that like to eat 2 bites out of a mango and leave it. So what we like to do is when they get ripe, we process them and freeze them. So we have them to eat frozen, thaw them out in little bags, or use them for ice cream. So my favorite dessert that people heard before is I take a little pint jar and I put a frozen banana in the bottom. In the wintertime, when I don't have mangoes, I use blueberries. But in the summertime, when they're mango, I put mangoes on top and some soy milk, and that makes a beautiful dessert. It's one of our favorite things. But for breakfast these days, it's watermelon, cherries, mangoes, blueberries for me. I had my first Santa Claus melon. If you haven't seen one of those, check it out. It's really pretty much an ugly honeydew. I don't taste much watermelon in it. Our Sprouts Market, we did a tour, and they had them, and we asked them if they would cut for us to taste, and they're quite good. So it's an excellent honeydew type tasting melon. It's dark green on the outside with it almost looks more like a pumpkin or an acorn squash color than it does a watermelon color or a honeydew color, but inside it's light green and low in the fiber and very, very sweet. So check that out. The other fruit that I had today was a mamey. Mamey is a South American fruit that I've talked about before, probably last summer, but they sometimes carry them at Sprouts. I got it at a local produce store here that we have called Detweiler's for people that are in the area. But a mamey and Sapota family, it looks barkish on the outside, so kind of the color of a kiwi, but it's bigger than a softball, shaped more oblong. The inside is salmon color, has the consistency a little bit of a sweet potato, not quite as fibrous, but very, very sweet. You have to wait till they become soft on the outside. So if you squeeze it, you kind of leave a mark, because otherwise it's the taste would be very stringent and bad. They usually have a couple big seeds in them that you can easily get around. And I actually just peel part of the top off and or peel a piece at a time or cut a piece at a time and then put the rest in the refrigerator. So I have mamey. I also have a sapodilla, white sapodilla, and that is another brown, round fruit the size of a plum. And again, it's kind of like a kiwi size, and you wait till that gets soft to touch. And inside the flesh is brown. The other way you know if it's ripe or not is you take your thumbnail and you scrape the skin, and if it's underneath is brown, you know if it's ripe. If it's green, don't eat it. But it has the consistency of kind of a brown sugar pear, so very, very sweet, but a pear type fiber consistency that's delicious. So I have a few of those as well. So this is my favorite time of year for fruit. So I typically have a tablespoon of chia seeds. I put a little soy milk on, put it in the microwave for 40 seconds, and then I put my fruit on top of the chia seeds, so I get my omega-3s, have my fruit. Then I have a piece of homemade sourdough toast with some fruit jam. So that is my typical breakfast on the weekdays. But we have fruit every day for breakfast in some form, whether they're maybe oatmeal on the weekends or maybe a plant-based pancake on the weekends. But fruit is always involved. So fruit after dinner, fruit after, and usually I have fruit after lunch. This time of year again, probably some watermelon. Fruit is very hydrating. Lots of vitamin C, lots of nutrients, fiber, so you can't go wrong. People that say that fruit is bad or fruit drives their sugar, it's not the fruit, it's what they're eating on top of it. I've had people complain that fruit caused them to gain weight. It was not the fruit, it was the other things people were eating, but they blamed the fruit because they'd rather eat the other things instead of the fruit, or they try to eat fruit on top of the other things. That doesn't work. So eat your fruit. It's colorful, hydrating, lots of nutrients, and then when you come back for your walk, I guess, and look at your heart rate and see what it shows. If you want some help in getting fit and getting cardiovascular fit and looking at heart rate and so forth, I'd love to help you. We take people all stages of life. 30 to 95, get them back on the road walking, adjust their heart rate for them, despite having diseases, because it's the best thing you can do. There's nobody that shouldn't be out walking. So our aim is to get everybody out walking, get them outside walking so they can be exposed to all the great things and the microbiome that's out there and the great things that we get from the outdoors. So if you're interested in us helping you, go over to drdulaney.com, doctordulaney.com, and give the website a check. You can always email me at jami@drdulaney.com with questions. And for all those people that continue to support me through my ankle injury and give me some suggestions and things to check out, I do check them out. I look into them and appreciate that greatly. And I'll keep you apprised of how things are going. But I'll be back in the mountains before long. Have a good one. Thanks for listening.